Hi everyone, I am Farah Khan and I am second year student at Gitanjali College of Pharmacy studying pharmacy. So today we're going to be talking about robotics application in cancer treatment. So before getting into the topic, first we'll have an introduction of what is cancer. So cancer is a disease in which abnormal cells grow uncontrollably and invade surrounding tissues. It can start in almost any part of the body and has the potential to spread or metastasize to other organs. Cancer happens with genetic mutations basically and divide uncontrollably, unlike the normal cells which grow, divide, and die in controllable manner. Here I have inserted a picture which is showing the cell division. Robotics has become an integral part of modern cancer treatment, improving surgical precision, reducing patient recovery time, and enhancing diagnostic and therapeutic procedures. These are the main focused benefits that has been done for the robotics approach in the oncological treatment. So here below is the detailed overview of the various applications of robotics in cancer care. So here are the six topics that we're going to be discussing here today, which is first one is robotic assisted surgery or RAS in shortcut, robotic radiosurgery, robotic biopsy and diagnosis, robotic drug delivery and chemotherapy, patient care and rehabilitation robots, research and surgical training. Let's dive into the first topic, that is robotic assisted surgery or RAS. It is a revolutionary advancement in cancer treatment, enabling surgeons to perform delicate and complex procedures with improved precision, flexibility, and control. It utilizes robotic systems operated by a human surgeon through a console. So here I have kept a image also which is showing how the surgery is going to be performed. In further slides, I'm going to be elaborating on it. Cancer surgery has been a critical component of oncological treatment for centuries. Traditionally, surgical procedures were open surgery with large incisions, prolonged recovery times, and higher risk of complications. The introduction of laparoscopic surgery in the late 20th century improved outcomes, but limitations such as restriction motion and poor depth perception led to the development of robotic assisted surgery or RAS. So today, robotics is transforming cancer surgery by enhancing precision, flexibility, and patient safety. Robotic surgery has emerged as a cutting-edge technology in the field of surgical oncology, transforming the way cancer is treated and offering numerous benefits for patients. Unlike traditional surgery, which relies on large incision and extensive manual manipulation by the surgeons, robotic surgery utilizes advanced robotic systems to perform minimally invasive procedures with enhanced precision and control. So, in short, the brief of this slide is nothing but the history was like started from the laparoscopic surgery introduction in the oncological treatment field, which was a little limitations had was restricted motion and poor depth perception, which led to these robotic approach, which leads to the precision, flexibility, and patient safety, which has been a revolutionary advancement in this field. So let's talk about the key technologies that is used in the RAS. So Da Vinci surgical system, the most widely used robotic platform, has been used in this robotic approach, which is equipped with four robotic arms, three for instruments, one for a 3D camera, master controls for the surgeon at a console, high definition magnified 3D vision systems. These systems enable surgeons to perform complex procedure with greater dexterity and visualization, reducing trauma to healthy tissues and improving recovery time. So in the further slides, I'm going to be showing how these really is going to be looking like the four robotic arms in the console. So let's get on. How does it work? Surgeons control robotic arms from a console using miniature instruments inserted through small incision to perform procedures with precision and dexterity. The system provides a magnified 3D view of the surgical site, enhancing visualization for the surgeon. Surgeon console is the first one, that is where the surgeon controls the robotic arms via joystick and foot pedals. Next is patient side cart. Robotic arms mimic the surgeon's hand movements and greater precision. Next is vision system. Provides real-time 3D imagery enhancing visibility of cancerous tissue. So in the next picture, I'm going to be showing how it is going to be looking like. So here is the slide where it is showing how the RAS will be going on in the OTs. First was the computer console from where the surgeon will be sitting and controlling the four robotic arms by foot pedals and joystick, where it will be mimicking, these four will be mimicking the hand movements with greater precision and dexterity. Here will be the visualization of the whole procedure on a screen, high definition. And here will be the patient. One will be this will be the camera inserted from here in through one robotic arm, and the three will be the needles and other procedure bleeding things that is going to be happen. And here will be the nurse assisting the whole procedure. Now let's talk about what type of cancer can be treated through the RAS approach in the oncology. So the first is the prostate cancer, which is where enabling the nerve sparing prostatectomies. Next will be colorectal cancer, assists in tumor removal while preserving surrounding tissue. Gynecologic cancers used for hysterectomy and lymph node dissection. Next will be head and neck cancers, assesses hard to reach areas with minimal disruptions. So here, not only about the cancer, I have inserted the information, but all like what are the procedures and what is going to be happen through this approach in these certain specific cancers also. Benefits, limits, and considerations. First will be the benefits. Benefits are precision. Movements are scaled and filtered to eliminate tremors. Minimally invasive, requires only small incisions, reducing trauma. Reduced blood loss, fewer transfusions, and shorter operative times. Faster recovery, less pain, shorter hospital stays, quicker return to daily life. Lower infection risk, smaller incisions reduce the risk of complications. Limitations and considerations. Cost. Higher upfront and operating costs compared to traditional surgery. Training. Requires specialized training for surgeons. Availability may not be accessible in all hospitals, particularly in developing regions. Our next topic is about robotic radiosurgery. Robotic radiosurgery uses precise, computer-controlled radiation beams to destroy cancerous tissues without incisions. It's highly effective for hard-to-reach or inoperable tumors. It is not surgery in the traditional sense because there is no incision. And here I have inserted an image for a demo view for how it is like really looks like. Key technology. The primary system used in robotic radiosurgery, particularly for cancer treatment, is the CyberKnife system, which integrates real-time imaging with a robotic arm that delivers radiation from multiple angles. So how does it really work? First will be imaging and targeting the tumor. The robotic arm adjusts in real time based on patient movement, like example is breathing. A high dose of focused radiation is delivered in fewer sessions compared to traditional radiotherapy. The system delivers higher doses of radiation directly to the tumor, destroying cancer cells while minimizing damage to surrounding healthy tissue. Multiple beams of radiations are used to target the tumor from different angles, further improving precision and reducing the risk of side effects. Here I have given a list of the cancers that are treated through robotic radiosurgery. First and foremost will be the brain tumors. Next is the lung cancer, spinal and spinal cord tumors, liver and pancreatic cancer, and prostate cancer. Benefits of using robotic radiosurgery. Firstly, it is non-invasive and painless procedure and no anesthesia required because this is not a surgery. There is no invasion or no cut is performed, as it is not a surgery. It is just a radiation therapy. It is done in outpatient with minimal recovery time. High accuracy minimizes damage to healthy tissues. These are the main benefits that is focusing on this robotic approach. Next is the limitations and considerations. So it is limited to tumors with well-defined boundaries. So it can be used to only those tumors or only those cancers which are localized and it is not spreading drastically. Next is high equipment cost, limited availability and specialized training, radiation related side effects. So obviously it is the equipments will be of high cost because it is a robotic approach and it is limited in hospitals and availability of such trained surgeons are also not much seen. That is also one of the limitations that we see. And radiation related side effects, so obviously there is involvement of radiation, so there will be side effects related to it. So our third topic is robotic biopsy and diagnosis. So robotic systems enhances the accuracy of cancer diagnosis by guiding needles on instrument with sub-millimeter precision. Traditional biopsy relies on manual insertion of the needles by the radiologist, while robotic approaches add higher stiffness and precision by a more stabilized robotic manipulator compared to human hands. As robotic diagnosis and biopsies are very much important because the initial stages only we can identify that yes, this person is diagnosed with so and so cancer. So here I've inserted an image also showing up the how it is done. So this one is showing the pulmonary related cancer biopsy and diagnosis. Here are the key technologies that are used in robotic biopsy and diagnosis. So there are two main technologies. First one is the robotic bronchoscopy, navigates the lungs to biopsy small nodules. Next one is the MRI compatible biopsy robots, enable procedures inside imaging machines for real-time accuracy. So the first one here we are seeing is robotic bronchoscopy. So this is the main one that is used for robotic approach biopsy and diagnosis of cancers. As lung cancer is the main and the first one to be seen through this robotic approach, and it is the first technology. And the next one is the MRI compatible biopsy robot. So here basically the images and MRI scans can be seen through robotic cameras, which is inserted through needles. In further slides, I'm going to be showing. So next is how does it work? The surgeon controls robotic arms from a console which manipulates specialized instruments. These instruments can be used to navigate through body cavities, assess tissues, and obtain biopsy samples. Image guidance like MRI or CT scan helps to precisely locate and target the biopsy site. So in the previous topic also of RAS, where we have talked about the robotic console, here is also the same procedure at first. It's like the robotic console is there from where the surgeon manipulates and instruments is inserted and where it is seeing through body cavities or assess the tissues and obtain the biopsy samples by locating, targeting, and then intervention is done. In this slide, I have taken an example of breast cancer robotic biopsy and diagnosis. So here I have kept the phases of robotic breast biopsy. The first will be the radiologist is checking the preoperative images and suggested paths. Then in the second image, you can see here in the B section where it is like localization is seen. The robot localizes the patient. Then the robot acquires in the second acquisition acquires US data of the site. So here the data has been registered. Here, see, registration is done. Then modeling of the whole data, preoperative data, and tracking are utilized to determine the target location after positioning. Then the intervention takes place where the needle is inserted through the robotic arm and the biopsy sample is taken and the biopsy is done. So here are the types of cancer treated listed. First and foremost one is the lung cancer through peripheral nodules. Next is prostate cancer, MRI guided biopsy is done. Next is breast, kidney and liver cancer, image guided. Just now I have showed you about the breast cancer in the previous slide. So that is image guided one. So here are the benefits, limitations and consideration listed down. The first one is the benefits we're going to be seeing. It is increased precision, minimally invasive, improved access, enhanced visualization, enhanced diagnostic confidence, fewer false negatives. As we can talk about is the first three are the common benefits we have seen in the previous topics also: precision, minimal invasive and improved access, and enhanced visualization also we have seen. The diagnostic here is done is very much confident the doctor is of, because it is very much precise and on point, and it is not false. There are very less cases of false diagnosis. Next we're going to be talking about is the limitations and considerations. So limitations, first one is this: still in development in some areas. Next is requires integrated imaging infrastructure. Robotic procedures can be expensive, but studies suggest potential for cost saving in some cases. So it is not available. It is very limited in hospitals. It is not seen in every hospital. It is more development is still required, and infrastructure and all of the imaging is also not really installed in all hospitals. We can't see, and it is very expensive procedure, and the instrument is also itself expensive, and it suggests that potentially for cost saving in some cases as well. It is not expensive in every case. Then the initial setup and training for robotic surgery can require investment. As I have told, it is not available, so investments are required. Then, like in any surgery, robotic biopsies have potential risks, although serious complications are rare. So obviously, like the biopsies and all, not in every cancer it can be done. It depends on what type of cancer the patient is holding, and through that the history and all of the considerations, then only we can do it. So there are certain limitations and considerations that should be looked out before performing such procedures. So our fourth topic is robotic drug delivery and chemotherapy. Robotic systems in chemotherapy and drug delivery are transforming traditional cancer treatment by improving precision, reduce human error, and personalizing care. These systems are classified mainly into two categories. First one is macro scale robotics, which is used in hospital settings. And the next is micro or nanoscale robotics used within the human body. So here are the two images showing the macro and micro robotics used. So the first one over there in the picture with the woman is the macro scale robotics, where the robotics are used in the compounding of the drugs through robotic approach, and which is controlled robotically and can be manipulated by human through the systems. The next one here is the images macro or nanoscale robotics, which is the nanorobots, which is inside the human body inserted, and the whole chemotherapy is done. So the first category is micro or nanorobots for targeted drug delivery. These are tiny robotic agents, often at the scale of micrometers or nanometers, which is where they derive the name nanorobots or microrobots, engineered to navigate the body and release chemotherapy drugs directly at the tumor site. Their working principle is as follows: designed to respond to specific stimuli. So example, like stimuli like tumors, specific pH, temperature, enzyme. So these are the specific stimuli to which it responds. Next is travel through the bloodstream to the tumor location. Release their drug payloads only when they reach the tumor microenvironments. So here are four types of nanorobots we're going to be talking about. First one is the DNA origami robots, where the DNA structures are programmed to open in the presence of certain cancer markers. Next is magnetic nanorobots. These nanorobots can be guided by magnetic field, allowing them to navigate to the tumor and deliver the drugs. Bionic nanorobots, these nanorobots mimic the movement patterns of natural organisms, allowing them to navigate through the bloodstream and reach the tumor. Example is like they uses microorganisms as their carriers of the nanorobots. Example, bacteria. The next one is the micro or nanorobots 4D printed. So these advanced devices constructed using 4D printing technology can change shape or behavior in response to external stimuli, enabling precise drug delivery. So first is we're going to be talking about is applications. Hard to reach tumors like pancreatic or brain cancers, tumors resistant to systemic chemotherapy, scenarios requiring ultra precise dosing. So these are the cases where it is applied and can be used in such scenarios. Next is advantages. Reduce systemic toxicity as there will be targeted drug therapies there. So it is not affecting the healthy tissues, only the one that is causing the cancer. Next is minimal invasive, no surgical access is needed. So it is not a surgery or there is no much of invasion, just a slight cut for the insertion of the robots. Next is potential for combined diagnosis and therapy. So it like normally not one type of cancer can also be seen. There can be combinations as well. For that scene also it is advantageous. Next is limitations. Still largely experimental or in clinical trials. Regulatory and ethical challenges for human use. Potential immune system interference. So, nanorobots are still in experimental and clinical trials, as it doesn't only have oncological treatment as well as its purpose. There are many other purposes it can be used for also. So that can be having a limitation for this treatment. Next is regulatory and ethical challenges because it is invasive process is there and there is insertion of a nanorobot in the human body. So it can cause issues over there as well. Then potentially immune system interference. So it is obviously there is a robot inserted in your body. So your immune system can be taking it up as a foreign particle or a foreign body which is not which should not be there in the body and it is invasive. So that can also be one of the limitations. Next category is robotic chemotherapy compounding systems. So these are automated pharmacy robots that prepare and dispense chemotherapy drugs in sterile environments. The popular system used here are Apotheca Chemo, Lichioni, Kiro Oncology, Vena's robotic chemotherapy dispenser. So these are the three popular systems that are very much used in the pharmacies as well. Next, how it works as chemotherapy preparation robots typically work by using arms, scales, and cameras to prepare chemotherapy drugs. Chemotherapy preparation robots use robotic arms to pick and place vials of chemotherapy drugs in a dispensing tray. Precisely mix and prepare chemotherapy doses based on physician orders. Operate in enclosed sterile chambers. Use barcode scanning and weight verification for accuracy. So this is how it is working up as. In the next slide, I'm going to be showing up the picture how it is really looks up. So here you can see the picture showing up how the compounding system looks up as. So applications, oncology pharmacies and hospitals, reducing pharmacist exposure to toxic chemicals, increasing throughput in high volume cancer centers. Then advantages, ensures dose accuracy and sterility, minimizes risk of occupational exposure, reduces waste and cost through precision, reduce workload on pharmacists and other healthcare professionals. Next is the limitations. High setup and maintenance costs requires integration with hospital IT systems. Initial staff training needed. So it is mainly seen in pharmacies, basically oncology pharmacies more in hospitals. And it is advantages where it is dose is precise and sterility is also seen. The occupational exposure is also minimized because it is a chemotherapy and it will affect the healthcare profession who is working with it. So there is minimization is also seen, and waste and cost also is reduced. And setup and maintenance cost is expensive. It can't be afforded within all hospitals, and it requires hospital IT systems integration. Then staff training is also required for how to use, and instructions is to be given. So there are certain limitation, advantages, and applications to all of this. Our fifth topic here is patient care and rehabilitation robots. These robots support cancer patients beyond clinical treatment, focusing on improving quality of life, mobility, emotional well-being, and independence during recovery and long-term care. So here in the picture also you can see a robot is assisting the patient which is dependent and who is needed care, where the robot is saying on the screen over there you can see drinking water. So it is assisting the patients who are not physically able, or who are dependent on some or the other person for their normal life. For those, such robots are used. So the first one here is assistive robots. So assistive robots help patients manage daily tasks like fetching items, reminding medications, especially when fatigue, motor impairment, or cognitive decline affects independence. Used in case of an elderly cancer patient living alone and patient with cognitive or physical disabilities post-treatment. Benefits: reduces caregiver workload, maintains patient dignity and autonomy, alleviates loneliness and depression. Challenges: limited emotional depth in AI interaction, high cost and cultural acceptance. So obviously, and not any robot can fulfill the family or a close relative or friend interaction and emotional connection. That is one of the challenges seen, and here is seen, and high cost and cultural acceptance also. So it is not accepted, especially in India, much of it, because a robot can't fulfill or take up a family's place as well. That is one of the challenges and the limitations seen. Next is the robotic exoskeletons. These wearable robotic devices assist patients who suffer from muscle weakness, nerve damage, or post-surgical mobility limitations. So key systems used are Exoner or Exobionics for gait training and physical rehab. Rework Robotics, lower body exoskeleton enabling paraplegic patients to walk. Hall, hybrid assistive limb, uses bioelectrical signals to initiate movement. So here, these are the three systems used. In the next slide, I'll be showing how it is really looking up as. So here in the image, you can see one of the examples of how the robotic exoskeleton looks up as, and how is the patient is going to be wearing and how it is going to be used. So uses are after surgeries affecting the spine, brain, or limbs. In cases of chemo-induced neurotherapy or muscle atrophy, rehabilitation after tumor removal surgeries that affect balance or coordination. So these are the uses that are seen in such certain scenarios. Whereas for advantages, accelerates physical therapy outcomes, restores mobility and builds confidence, enables remote monitoring of gait process. Limitations: needs professional supervision initially, not suitable for all body types or comorbidities, expensive and often not covered by insurance. Robotic beds and mobility aids. These are semi-autonomous systems that help with posture adjustment, pressure relief, and safe transfers. What are the features of it? It is automated repositioning to prevent bed sores, lifting systems for transfers from bed to wheelchairs, sensors to monitor movement, pressure, and sleep quality. What are the examples? First one is the robotic beds like Robert, which is from Japan, that lift and transfer patient. Regarding this only, I have inserted the image here. Next is smart wheelchair with autonomous navigation. Example, Well Model C. What are the benefits? Prevents complications like ulcers or contractures, reduces need for physical handling by staff, offers patients greater autonomy in patients and homes. The last topic here is research and surgical training. So robotic technologies have not only improved the way cancer is treated, but also transformed how surgeons and medical professionals are trained. Simulation-based training and robotic research platforms provide safe, repeatable, and high-fidelity environments for learning complex cancer surgeries. Under this, first one we're going to be talking about is robotic surgical simulators. So these are the systems replicate real-world surgical environments, allowing trainees to practice using robotic instruments without involving real patients. Example of these technologies used are Da Vinci Skills Simulator attaches to the Da Vinci console and allows practice using actual controls. Mimic Flex VR, a portable simulator that mimics robotic surgical movements. Virtamed and Symbionic simulators use VR and haptic feedback for procedural rehearsal. So these are the three technologies mainly used in this surgical simulators. Da Vinci Skill Simulator, I guess you people remember, we have spoken about this in the RAS, robotic assisted surgeries as well. So that is the main one that is used for the surgeries and training the healthcare professionals. Future. The features are 3D modeling of anatomical structures, real-time feedback on performance, example time, precision, and efficacy seen, simulation of common and rare surgical scenarios. So here you can see a picture of a surgical robotic simulator interface where there is all of this is explained. Arm support, haptic interfaces, VR visor, VR simulation scenes there, and pedals, how it is controlled. So this is how it is a robotic simulator looks like. Then what is the applications? Training on robotic assisted surgeries, example prostatectomy, hysterectomy, practicing complex oncology procedures in urology, gynecology, and thoracic surgery, safe environments for learning anatomy, surgical steps, and error management. So not only for oncological based surgery procedures it is used for, it can be used for the other surgeries as well, which robotic application is seen. Then benefits are reduces the learning curve for novice surgeons, prevents errors during live surgeries, allows repeat practice and self-paced learning. Limitations: high cost of simulation and platforms, need for integration into medical education systems. Robotic platforms for innovation. Research and development in cancer robotics rely on experimental platforms that test new surgical techniques, tools, and control algorithms. Use cases are testing novel robotic arms or end effectors for better precision, AI-assisted control systems that offer suggestions or automatic corrections, collaborative surgery simulations where multiple surgeons work together using connected platforms. These are the cases used for research platforms or innovation. Examples are Raven 2, an open source surgical robot used in academic research. SimSurge, a platform used to analyze and optimize robotic surgery strategies. What are the goals of this? Improve robotic instrument design, develop autonomous or semi-autonomous systems, explore AI, enhance decision-making in surgery. So research platforms for innovation are where the cancer in robotics and other surgery treatments are also seen. So these are all the things, and the goals of it is to improve. Basically, it is to improve, and more advancement is there, and it is seen. So through these all Raven 2 and SimSurge, these all can be done. So the last subtopic is virtual reality, VR, and augmented reality, AR. VR and AR are being integrated into surgical training for immersive real-time visualization of anatomy and surgical planning. So VR systems used to stimulate surgeries in fully digital environment, enhance spatial awareness and depth perception. Whereas for AR systems, overlay digital data, example CT or MRI scan, onto a physical surgical model or the patient. Improve intraoperative navigation and planning. So here VR, it is where the here we have seen in the simulation, robotic simulation as well, surgical simulation. It is the where the virtual reality is kept, and it is not the real one. And all digitally overlay thing is done. Whereas for AR system, the data is overlaid on the patient or the physical model of the patient, and the surgery planning and navigation can be done. Applications: pre-surgical planning for complex tumors, intraoperative guidance in robotic surgery, team-based training and procedure rehearsal. So here in the image also as well, you can see where the um, sir is teaching the other trainees for how the planning or pre-surgical intraoperative guidance is done for the robotic surgery or for complex cases of the tumors in the cancer. What are the future outlooks? The future of robotics and cancer treatment is poised for major advancements through integration of artificial intelligence, miniaturized nanotechnology, and remote operation capabilities. Innovations will focus on AI-assisted diagnostics and surgeries to enhance precision and decision making. Smart nanorobots for targeted drug delivery and real-time monitoring inside the body. Remote robotic surgeries to expand access and underserved areas. Advanced rehabilitation systems to support long-term patient recovery. Immersive robotic training simulators with VR or AR and adaptive AI feedback. Together, these developments aim to make cancer care more personalized, accessible, and effective, improving outcomes and quality of life for patients worldwide. So this is the main brief of what my topic was of robotics and cancer treatment. This is the main conclusion here. The reference links from where the information is taken, and further information, if needed, can also be searched up. Thank you for watching this video, and we will still be advancing cancer care through robotics as well. Thank you.